2, 3.
Hi, my name's Sharon Marsh and I'm the National Sales and Training Manager at SkinMed Australia. Today I'm here to demonstrate the MesoSkin treatment. It's just a run through on how to use the system and also what the treatment looks like on the client. So firstly, I'm just going to bring you over to the machine so you know that you how to actually use it and set it up before you start work on your client. So to start up, we press the button at the back. So this will actually turn your system on. And we press the button here, which will bring up the home screen, and we just press on the home screen. So the way this works is a combination of electroproration technology and transdermal microchip technology, and the two work in combination to produce that breaking of the epidermis and transmitting the product down to the mesoderm. So the way we work it out is that the electroporation setting is the pulse, the contact degree is the depth of the micro hollow transdermal needles, and the dosage is how quickly the product is coming out, and the frequency is how quickly you're moving across the skin. So for a beginner treatment, and for someone who say has a normal skin, you would use an electroporation of 3 and a contact degree of 2, and we're working with a dosage of 5 and a frequency of 5. So to actually set up the handpiece, we've already pre-syringe formula product into the syringe. For this customer today, we're using vitamin C for brightening and anti-aging. So what we do is we will be coming to the set button, and we're going to be clicking replace, and this is going to allow us to put our microchip into the handpiece. First of all, we do need to pop our gloves on because this is a sterile process and we don't want any cross-contamination from our hands onto the client's skin. So our disposable microchips, these are a per use per client, and we're going to open that wearing our gloves. And the way the microchip goes in is we've clicked on the replace button, and that has brought the head of where the microchip goes in, the cartridge out. So we are marrying up the little groove in the microchip with the groove in the actual head, and we're going to clip that in and we're going to push down. So that's then going to expose the microchip. We're then going to go press the back button. We're going to press our trigger on the side just to make the syringe holder go back. Clip the syringe into place, and then we're going to move the connector and attach it to the top of the syringe. Then what we're going to do is we're going to click on the 4th button to bring the holder back into place. So we're just going to press that until we get it to where we want it to be. We're going to put our hand on the connector, and we're just going to tap that up until we can see some product being pushed through. Okay, and then we're going to hit save. So that's now all ready to go. So as I mentioned, on this customer, working with electroporation of 3, contact degree of 2, dosage of 5 and a frequency of 5. If you're working a little bit slower to start with, you can reduce the dosage down to 3. It just means the product will push out a little less quickly, so it gives you a bit more time to work. All right, now moving to the client's skin, that's all ready to go now. We're going to cleanse the client's skin, and we've already cleansed in this case. And it's important that we need to degrease the skin, so we're going to use the exception degreaser to clean any residue off the skin after we've cleaned the skin. Do the neck as well. It's also really important to make sure you take photos first, before and afters of your client, and that way you're able to see a good result. It's always good to keep records, especially if your client's having a course of treatment. Okay, that looks pretty good. Now after we've degreased the skin, we're actually going to use an antibacterial wipe. I recommend an alcohol-free version, that way you won't harm the clients who have sensitive skin. These are antibacterial medi wipes you can purchase from medical supply shops. So we're just making sure that's all So now we're ready to perform the treatment. So we're just going to move our client's head to the left, and we're going to start on the chin area and work our way up the face around the forehead, and then we're going to finish with the neck. So 4 ml product's a good amount, and we're going to do 2 passes. The first pass is going to be using the product. If the product is still sitting on the client's face after you do a first round, you can actually change the system to cavity mode, and cavity mode will push the remaining product that's on the surface of the skin down into the skin. Otherwise, if your client is receiving the product quite well, you would just continue over the face again in normal mode. So we hit the start button. And we pop it to the client's skin so they can actually feel the microchips touching. And then we are going to hit the start button. And that we move that across the client's face. So there's product coming out through the hollow transdermal needles onto the skin, and we're going to move across the skin. So we wipe the product back, and then we're going to start again. We ask our client, how's the comfort? Is that okay? That's comfortable for you? Yeah. So you can see I'm moving quite quickly. So this treatment, full face and neck, should only take you 15 minutes. But the great thing about this system is you can actually perform the treatment around the eye area without any problem at all. So we go right up under the eye area. Now we just ask the client how they're feeling. Is that okay? Still comfortable for you?
Thank you.
Because if the client says they're feeling a little discomfort, you can actually turn the electroproration down to 2. Because in this area we do have a lot of nerve endings, so and not as much fat in the forehead as we do in the cheek area. Just move that client to the middle. And then we're going to do up to the eye area as well. So I'm just going to demonstrate one side of the face for the purposes of the video. We would then, once we've done the other side, then move down to the neck. Now Anita's skin has taken that quite well. So we would then continue with the rest of the liquid that's in the syringe, and we would do another pass. If her skin, if there was product still sitting all over the skin, we would then change it to cavity mode and finish the treatment. So the important thing is after you've done the treatment, you cradle and stop. If you are wanting to change the machine to cavity mode, you click stop and cavity mode, and then cavity mode with a little tick beside it will mean that the system is working, sending the electroporation technology down through the transdermal microchip, but it won't be actually delivering any product through the syringe. So to go back to our other mode, we would just click on cavity mode again, which will take away the tick, and then hit start, which means we're back in mode where product's being delivered. To finish the treatment off, we finish with some toner, so a mist. And it's really important that your client wears sunscreen after this treatment. The channels will stay open for 20 minutes. So great opportunity to do an LED light therapy treatment after the MesoSkin treatment. And that then will close those channels off. But you just finish with some SPF Sun All Day Shield on client's skin. And as always, just making sure our client is wearing sunscreen for at least 7 days after treatment. I mean, we should always encourage them to wear sunscreen every day, but at least 7 days. Thanks for watching.